My name's Johnny, and today I'm on my way to Westminster to meet Luciana Berger. Luciana is a Member of Parliament and has held the position of Shadow Minister for Mental Health, and she is currently the President of the Labour Campaign for Mental Health. She has received the backing of many parliamentarians to ring-fence mental health spending by the government, and actively works to promote mental health in Westminster. Luciana works with charities, academics and politicians in raising awareness of mental health and creating political change in the field. I guess what people probably most know me for is the incident on the bridge. I ran away from hospital and went to a bridge, and I was basically stopped by a stranger who was walking past on his way to work, and he stopped and he came over and he stopped me from what I was about to do, and essentially saved my life, I suppose. And fast forward then 6 years, when I was in a much better place, I launched a campaign to find him, which I called the Find Mike campaign in 2014. And we found him through social media. We worked together ever since, and he's also now an incredibly passionate and active campaigner, which is amazing. We all know there's a long way to go in terms of mental health and the kind of the parity of esteem between physical health and mental health. We know there's a long way to go. So I think Luciana, more than most, has done amazing work. So I'm really looking forward to chatting about that and also the future. I guess I wanted to start by kind of asking why you're so passionate and where did this passion and drive to kind of change mental health come from?
Well, mental health, I think, touches us all, even if we don't like to think about it, whether it's our own mental health or whether it's the mental health of our close loved ones, friends and family around us. Some of my earliest memories of a very close family member who I recall growing up, I went to go visit in various inpatient settings.
Sure.
That's obviously a formative memory of mine. Yeah. Within a family which is very similar to lots of families where we didn't talk about mental health.
As far back as you remember, you said growing up it wasn't talked about. How do you think it's changed?
We're certainly on a journey. We're not by any stretch of the imagination at the end of that journey, but there's definitely stark differences between then and now in terms of how much more mental health has entered the public lexicon and debate, how much more we discuss it and are prepared to be open about it. We can actually, I think, politically look back to a really key moment when there was a debate about mental health in the House where a number of my colleagues were very open about their own experiences, and that then was seen as quite brave. Famous people, Frankie from the Saturdays comes to mind. We've seen Alistair Campbell, Zayn Malik. There's a growing list of famous faces that are prepared to speak about their mental health in the same way that you'd expect them to about their physical health, but we've still got some distance to go. And I suppose what I really focus on is that challenging the stigma and discrimination is really important, but in and of itself it's not enough. And it's what else we do to ensure that when people have the confidence to come forward, that actually there's the services and support available to really help them, and that's a massive challenge in many parts of the country, including where I'm a Member of Parliament. And making sure also we don't just see it through the prism of the Department of Health and through the National Health Service, because actually, I talk quite openly about, I do think that our country is suffering a mental health crisis. I do not use that term lightly. I'm not using it for political gain, but genuinely I think that's the challenge that we face. We're waiting to see the outcomes of the prevalence study in a few months' time, which will tell us how many young people are affected by mental ill health. The study back from 2004 told us that it was 1 in every 10 children, so 3 children in every classroom, and everyone's expecting that figure to be much greater than it is. And so if we're adequately going to contend with it, not just what happens to children, but children are really important, but everyone at every moment in their life course, then it's what happens outside of the Department of Health and outside of the NHS which will ultimately make the difference. And I think we're very far from actually getting what happens in education, what happens in business, what happens in our communities, really thinking in those areas about what more can and should be done to keep people well, and especially what can be done to keep people mentally well.
Can we move on and talk about suicide? Because obviously massive issue. We know it's the biggest killer of young men in this country. Yeah. Not enough is being done about it. What more can we do to address this massive problem?
So this is something that pains me. This is something that I'm really, really, really bothered by, the fact that over 6,000 people in our country take their life, that either haven't been able to access services or don't feel that there's a support available to them. In particular, I kind of raised the issue of people that have taken their lives in our prisons, because I think in a civilised country in 2018, it just can't be right that over 100 people have taken their lives in our prison settings. And while individual organisations are kind of doing their bit to contend with, for example, suicide on our railways, where National Rail, together with the train companies and Samaritans, are doing a really constructive job to minimise the opportunities for people to do that. In terms of location, but that's still not actually massively reducing the figures. So it's not just about location; it's about how can we help people? How can we do the most possible to minimise people thinking that that's their only way. That's their only way out. I'm very proud to have supported the creation of the Zero Suicide Alliance, which is just one small thing that can make a difference to providing people with the language and the tools to know how to contend with someone that's having suicidal thoughts. Because I think for lots of people, they just don't know how to deal with it. Should they come across it, like, what do I do? And I think also, this all comes back to, in my view, to emotional and mental health literacy. And this is where the role of schools is so important. And really starting early, talking about mental health. I think we can point to some really a number of schools that are really fantastic in this area, that are really passionate about their students' mental health. Now, some of those schools previously had a lot more provision than they currently do because of the cuts that they've seen to their budget. So schools that previously invested a lot in pastoral care workers, peer mentors, counsellors in school, educational psychologists, they are far and fewer between because of the reductions in their budgets, but still they're able to do things within a school environment to equip their students with, again, the confidence and the language and tools to deal with their own feelings and emotions and mental health well-being. And it's what more we can be doing from this place in the House of Commons to really get ministers in the Department of Education to value this kind of I think this, in my view, critical area of education, about equipping that next generation, not just with the academic tools and knowledge, but also, as people, how do we give them the best chances of having, great lives into adulthood in terms of both their physical health and their mental health. And again, that's a role for many of us in this place that really want to see personal, social and health education beefed up, put on a footing within the curriculum where it's valued, where it's adequately resourced, and really kind of put centre within our schools.
I think probably my biggest bugbear is CAMS, the Child and Adolescent Mental Health Service, and their cut-off at the age of 18, which just does not make sense. People are cut off at the age of 18, their treatment stopped, and then sometimes they don't get anything more. There's a long wait to the adult mental health services, different thresholds. Yeah. Is that ever going to change? I mean, it doesn't make sense to me. I don't know what you think about the whole cut-off age at 18. And
well, in some places it's 16, which is even worse. And we have to look at experiences in other parts of the world, like Australia, for example, where they very they do a much better job, I think, than us of actually contending with young people's mental health right into adulthood. It's something that's been bandied about that we should move to this 0 to 25 model, and in fact they have done it in a couple of parts of the country, like Birmingham, for example. And it's not entirely perfect. One of the groups where it doesn't really fit is for perinatal mental health. So new mums under the age of 25, if they're suffering it, that's one area which doesn't quite fit. But other than that, it's obviously really important to ensure that continuity of care for young people. So it's not this cliff edge, either from 16 or 18, transitioning into adult services that look and feel very different might not be appropriate. If someone's in the middle of treatment, the idea that they suddenly they reach an age, it's their birthday, and they've got to start all over again, see someone else might not, as you say, reach the thresholds to get support. That's just not appropriate. I would support us moving to 0 to 25 services across the country for mental health, because, again, the overwhelming majority of adults with a diagnosable mental health condition will have developed it under the age of 14. They will have developed it under the age of 14, but they might not get any support until 15, 16, 17, 18. And therefore, to give that young person the best chance into adulthood to treat. We know we can treat many things under the age of 18. That's what we should be doing. Of course, we should ensure that kind of seamless support and treatment.
And if you yourself personally, if you could maybe just do three things,
and
I know it's just three, but obviously more, to change and improve the situation, what do you think those three things would be?
And I'll say it again, we are not going to solve our nation's mental health crisis from the Department of Health alone. It's what happens in our workplaces and in our schools and in our communities that will ultimately make the difference. So that's just one suggestion of something that I think could really affect some positive change. I want to see us having a disproportionate focus on the 0 to 5s. Even now, when we talk about children and young people, it's not really about the under 5s. And the evidence exists of particularly where conception to 2 will determine that young person's life outcomes. So, doing so much more then, I think, and investing at that moment could have some really positive, far-reaching outcomes that would make me really, really happy. And at the very least, protecting the money that we know is there for, across all of mental health. That ring fencing idea, it's by no means a perfect policy intervention, but at the very least at this moment, I think it would go some way to ensuring that we protect the services that we have. And to making sure that people, at the very least, that they can't be raided to pay for other parts of our NHS when we know our NHS is under such pressure.
I guess to finish then, what are your kind of ultimate hopes for the future? It's a hard one again.
Sure. Aspirationally, I want to live in a country that, in more than words, really treats anyone suffering with mental health in the same way that we treat and contend with people that suffer with their physical health. That's the prize that I'm really focusing on, and also to be doing everything possible to shift what is now, in my view, a disproportionate reliance and concentration on what we do, as I said, when someone's in a crisis. And I want us to get as far away from that as possible and really focus on what we do to prevent mental health in the first place. Because I think for the social reasons, for the moral reasons, and also for the economic reasons, it can make a great difference to people in this country.